Presenting tonight at our 63rd Speaker Series presentation, we have Dr. Matt Brignall, medical professional from Tacoma-Pierce County Health Department, and with him is Rachel Hauser from the Health Department's Community Outreach Program. Dr. Matt will speak about the Omicron variant of COVID-19, vaccine updates, new isolation and quarantine guidance, and new therapeutic options. And then he will take our questions, and pretty sure he has all the answers for us. And with that, I'm going to turn it over to Rachel.
Thank you so much, Robin. Thank you for having us. I am Rachel Hauser. I am a community health worker with Tacoma-Pierce County Health Department. Robin had reached out to us, our community engagement team, as far as speaking as a member of this speaker series. So I wanted to start by touching on a little bit of what our community engagement team does before I handed it over to Dr. Matt. So the community engagement team, the whole goal is just to engage the community as far as community health goals. Right now, we focus quite a bit of our energy on the COVID-19 response. And so some of the work that leads to is organizing and setting up vaccine clinics or testing sites. Thank you so much to Robin for them hosting these upcoming clinics. We also do some tabling with resources and different events that we can represent Tacoma-Pierce County Health Department at, just sharing resources, answering questions that the community may have. We also can connect businesses to testing, businesses and organizations to testing, and I'll be happy to share some information about how you can fill out a form and directly request testing through us. And another thing we do is presentations such as today. We really just want to engage the community and share the information that we have, answer questions, really are all in this together. So however we can best serve you is what we're here for. So I'll share my information so that you all can reach out to me should you have any questions, comments, concerns, or just suggestions or ideas for how that we can engage with you. So with that, I will turn it over to Dr. Matt and take it away.
Hi, everybody. Thanks for having me. So I'm Matt Brignall. I'm a naturopathic doctor, and I have a community clinic in Tacoma. I've been working for the COVID-19 response since March of 2020. Since our first testing outreach in the Tacoma Dome, I started through the branch of FEMA, the medical branch of FEMA, which is MRC, or Medical Reserve Corps. And I've been an employee of the health department since I think July of 2020. First doing testing, helping nursing homes with outbreaks, doing vaccine clinics, and now doing outreach to the community. So, we make a joke on my team, but my team's job is to help people keep up with the new guidance changes as they come down from the CDC. And our standing joke is the CDC really only changes guidance on days that ends with a Y. So, there's been a lot of stuff that's happened over the last month, and I want to go through as much of it as I can, but I also understand there are going to be questions along the way. So there's a chat box you'll see at the bottom of the Zoom. I think a lot of you are probably familiar with Zoom by now. If you think of a question as I go along, just go ahead and type it in the window. Rachel, keep an eye on those, and then at the end, we'll try to make sure everybody's question gets answered before we fold up the tent. So these are a few of the things I've got slides on tonight. There are a few other topics I'm going to touch on, but this is the basic stuff. So we've been using this model of Swiss cheese to talk about prevention of COVID-19. This comes from a buddy of mine, Ian McKay. He's a doctor down in Australia, and he helps me with a lot of the vaccine outreach stuff that we've been doing for a decade or so now. The idea here, Swiss cheese has holes in it, famously. And if you picture these little virus particles over here on the left side of the screen, sure, some of them sneak through the holes in the first piece of cheese, a couple of them make it through the second. The idea is to come up with enough imperfect prevention protocol pieces that we end up keeping at least most, if not all, of the viruses from getting into our nose and our oropharynx. So one of the things on here that I think is probably the one that's most controversial, and frankly, I think people are the most tired of, is masking. I do see as I go out into the community that the interest in masking is variable in different parts of the county. I think that's the most polite way to put it. Some parts of the county are still fairly engaged, some are not. But the thing that I want to call everybody's attention to is that the CDC changed their guidance around masking earlier this week. We've not yet been able to build public messaging around it. But I think the biggest thing I want people to understand about masks is if you can hold that mask up to the light and you can see through it, you can see the light through it, that's probably not a mask. We want it to be probably a couple layers if it's cloth, and we want it to be very densely woven fabric. I see a lot of people walking around with bandanas and other, sort of single layered fabric. That's not doing much to prevent Omicron from getting into your lungs. Next slide here. So I know this is not news to folks. The Omicron variant is the most contagious infectious disease in my lifetime. I was born the same year, 1969, the same year measles vaccine got to be widespread in communities. Measles was the most infectious viral disease known, and still is. But this Omicron variant approaches it. It's twice as infectious as the Delta variant, which was twice as infectious as the previous variants. So when you look at the number of cases we've got right now, we've got about 4 times as many cases in the county as we had in previous waves. That first bullet point on this slide is a little bit controversial. It's definitely more contagious. The less severe is a little bit harder to understand. A lot of people have had COVID so far, and a lot of people have been vaccinated against COVID. So it's a little bit, if those things weren't true, I suspect this might be nearly as or maybe equally as dangerous as previous rounds. But we are still seeing that the vaccinations, and especially the booster shots, are protecting people from the most serious illnesses, hospitalizations, and deaths. That said, we're starting to lose the messaging on vaccinations. I think we all by now not only know somebody who's got COVID, but we know somebody's had a breakthrough case, somebody who's fully vaccinated who got sick. This is troubling. And I think, I'm increasingly worried that if we go through future rounds of this, so we might need to change the vaccination to keep up with the mutations in these succeeding waves. But where we are right now, if you're vaccinated, you're 10 times less likely to end up in a hospital, 10 times less likely to die of this disease. So that is still significant protection, and it still is an effective vaccine. I know everybody's heard this by now. We have 3 vaccines, Pfizer, Moderna, and Johnson & Johnson. What snuck out around Christmas time, and I fear a lot of people missed, is that the CDC came out with guidance that I've been hoping would have come out as early as this summer, that Moderna and Pfizer are just really better vaccines than Johnson & Johnson by any measure. They're more efficacious, they're safer. So finally, the CDC has given us a preferential recommendation that really should do the Pfizer and the Moderna vaccine, unless you're allergic to one of the constituents. These are 2-dose vaccines. A 3rd dose is recommended if you have an immunocompromised condition. That's about 1 in 50 people in the country. The Pfizer's for 5 years and older, and the Moderna's for people over 18. Booster doses, this has been the single toughest moving target for us to stay out in front of as we do messaging in the community. And, we put these slides together, and by the time that we have them approved by our communications group, they're already outdated. But the biggest change on this slide in the last month has been that we're now doing booster doses at 5 months instead of 6 months. The reason why we did this is because of the Omicron variant. And there really is a significant dip between that 5-month and 6-month period. I apologize. There is, the slide is updated. So booster doses are recommended for people over the age of 12, the 5 to 11 group. We haven't been watching them long enough to know if they require a booster shot. And my suspicion is that we'll be seeing pretty soon when they get to the 5-month window, we'll probably be doing boosters for that group as well. The booster doses, it's so interesting to watch, because right now, if you're fully vaccinated, you had the 2-dose series, but you had it more than 6 months ago, you're not doing that much better with regard to cases of Omicron. You're doing better with hospitalizations and death, but you're not doing that much better with just raw case numbers than people who didn't get vaccinated at all. But if you had that third booster dose on, then all of a sudden you've got about a 3 times lower case rate, as well as all the other benefits around serious disease. You can mix and match your boosters. If you had Moderna, you can get Pfizer. I did that. I did the Moderna first. I got the Pfizer second because it's made in my hometown. And I thought I should have some hometown pride. If you're from Kalamazoo, Michigan, there's not a lot of hometown pride. So the Moderna or the Pfizer vaccine's about all we've got. If you were vaccinated with Johnson & Johnson in the first place, you really should get an mRNA booster if it's available to you. Does anybody know what vaccine we're doing at the clinic at the church?
All of them.
All of them. Great. Okay. Like a buffet.
And Matt, I have
yeah.
a question real quick. Gretchen is asking, what is the difference between a third dose and a booster?
Yeah, thank you. That's an important distinction. It's one that we haven't messaged very well. So most people are recommended for a 2-dose series of Pfizer and Moderna. We add a third dose to that series after the second month. So 1 dose, wait a month, 2 dose, wait a month, third dose. For people who are immunocompromised. These are people on cancer therapy, people with autoimmune disease on medications that affect the immune system, some people with inborn immune problems. So most people, third dose doesn't apply. 1 in 50 it does. And the third dose is not a booster dose. It doesn't change the recommendation for a booster dose down the road. Hopefully, does that answer the question?
Do you have to do the third dose and then the booster, or can you get a booster and then add a third dose if you're one of those autoimmune?
Gotcha. I've never heard that question asked that way. I guess technically the booster dose would be the third dose, even if you waited some time and did it at the time when the booster would normally be there. And if I were, that's a question that's not covered in the CDC guidance. But if I were working at a clinic, I would say if you got that third dose several months after the series was done, you would still wait the 5 months to do the booster dose. Okay. Right, moving to the next slide. So the other big guidance change in the last week or 2 weeks now, is we got some changed quarantine and isolation guidance from the CDC. So I want to clarify these terms because a lot of people get tripped up with them. Quarantine is I got exposed to disease and I don't know if I'm sick. I'm sort of waiting to see if I get sick. Isolation is I know I'm sick and I'm probably COVID positive. So now I'm a known disease case. So I'll start with the quarantine guidance. The quarantine guidance is the first time that we've created a different category for people who have had the booster. So previously, vaccinated people didn't quarantine, unvaccinated people did. Now, because we're seeing that the booster dose is really the big difference, now we've changed the guidance to be fully vaccinated and boosted. And you'll start hearing, it's not on this slide, but as soon as next week, you're going to start hearing the phrase up to date on vaccinations. That means I've had my series and I've had my booster. And the reason why we're using that new language is because if I had my series last week, I'm not eligible for the boosters. So I'm still technically up to date, and I would still be up to date with regard to the quarantine guidance. I apologize. This is terribly confusing, but hopefully that makes sense. If it didn't, stop me later. I'll come back around to it. So if you've not had your booster shot or you're not up to date on the vaccines, we'll ask that you stay home for 5 days. That's a big difference. It used to be 14 days, and then it was 10 days, and now it's 5 days. The reason this number is coming down is Omicron is a quicksilver variant. It gets on you quick, it goes away quick. So, and then after that 5 days, you can go back to work. We ask that you wear a mask when you do, but you can go back to work if you haven't developed symptoms. We recommend, testing's not available for everybody, but we recommend you do a test on day 5 if you don't develop symptoms, just to be sure. If you do develop symptoms and you know you were exposed, then we're going to consider you a case of COVID until we know otherwise. More on the quarantine guidance. If you were fully vaccinated and boosted, and again, you know you're exposed means you're within 6 feet of somebody for more than 15 minutes who's sick, then you should still wear a mask for those 10 days. And again, we're going to ask that you go to the bench the minute that you develop symptoms. There's an infographic here. Rachel, is there a chance that you can pop that infographic into the chat? Thank you. Thank you. And that graphic will be a reference that you can come back to around this. So the isolation guidance, this also has changed and gotten a lot shorter. This used to be 10 days. If you had a positive test, you're on the bench for 10 days. Now it's 5 days. Again, this is because the University of Washington did this work. We see that 95% of people are not shedding virus at 5 days. One quick point of clarification, the day you get sick is not day 1, it's day 0. So then 1, 2, 3, 4, 5 beyond that, then you can go to work on day 6. We don't require testing at the end of the isolation period. There's only so many tests available. Probably some of you guys have seen the lines at the testing site at the fairgrounds. They're substantial. So if you're feeling better at the end of that 5 days, meaning your fever's gone, you don't have a bad cough, and your sore throat's gone, then you're able to go back to work. Again, we're going to ask that you wear a mask for 5 days after to hedge our bets. But that's a pretty big improvement, and that's going to help a lot of people who've been asked to sacrifice a fair amount of money for not being able to work after they've gotten COVID. You know, it's a double whammy, right? You've gotten really sick, and now your family's going to have to struggle to make ends meet for another month. So, what's not on this slide, and I want to get to on this slide, we haven't developed slides yet to deal with these new treatments because they are so new. But we just got in this county a few days ago 4 new treatments for COVID-19. 2 of them are outpatient, 2 of them are inpatient. I'll start with the inpatient ones. These are antibody treatments. We give you an injection. One of them is 1 time, one of them is 3 times. These antibodies help you fight against COVID-19. And they'll reduce your risk of ending up in the hospital or dead by 90%. So they're a really big deal. The outpatient treatment, same thing, except these are now taken like a course of antibiotics or a 5-day oral treatment. Just got confirmation today. The Safeways have them. I think the Rite Aids have them too. So I can write you a prescription for that. You can go pick them up, or they'll even deliver them to you from certain pharmacies. You take those for 5 days at home, and they reduce your risk of going to the hospital and dying of disease. This is a remarkable breakthrough. It took us 2 years to get here, and I'm really excited about this. I don't want to say it's a game changer, but this is another really important tool in our tool belt to help to fight this pandemic. And again, we've got them available. If you get a positive test, the thing to do is to call your provider and ask if you're a person who will qualify. Now, the good news is that the treatments are here. The bad news is we don't have very many of them. So we're trying to save those treatments for our highest risk people. These are people who are unvaccinated, people over 65, people with autoimmune diseases or other immunosuppressing conditions. But we're going to triage those conditions based on risk. The highest risk people get the injected antibodies because they're the most efficacious treatment. The next tier down will be able to get the oral antimicrobials. My guess is, given the allocation schedules I've seen, that we'll get caught up to demand probably sometime in March. But until then, it's going to be really hard for us to distribute these in a manner that's equitable. So we're doing our best at the health department to do it. And finally, I think this is probably evident, but if you have a medical emergency, call 911. And when you call them, you want to make sure that you notify them that you're COVID positive. Another thing that's new and didn't make these slides, I put it in the chat box before I started. The federal government yesterday set up a website that'll send you 4 free tests. It's based on the postal system. It's really, really easy. Probably some of you have already done it. It took me less than a minute to fill out the website. This is a really great tool. We also just got word today that the state of Washington, with the help of Amazon, is going to build themselves a website that'll send you 5 free tests. So there's 9 free tests. The ones from the state of Washington are limited, so do that early. But and I don't have a link to that because it's not live yet. But these rapid tests are a really nice tool for us to have. A rapid test is not the same thing as a PCR test like you get at the fairground. The PCR test is a very accurate test. And if the question you're asking is, Can I go to a nursing home and see somebody who's high risk? Can I be around somebody who has cancer? The test you want is a PCR test. But if the test you're asking is, I'm sick and I think I might have COVID, that rapid test is fantastic. And it's really good. We're going to have those to help people through. So that's what I've got. I've got some links here to help with information around testing and around finding vaccine clinics. What questions do we have? Yeah, Gretchen.
Sorry, I'm here taking notes. So I have heard in regard to your last slide that a lot of people that are teachers that have gotten Omicron, or however you say it, initially the rapid test showed negative,
Yeah.
even though they had the symptoms, but the PCR a week later, or 3 or 4 days later, when they got that back, said, oh yeah, you have COVID. So
Yep.
I don't know if you have seen that.
100 times if I've seen it once.
Okay.
The PCR is a more sensitive test. It finds things the rapid tests don't, and it finds them on average 2 days earlier than the rapid tests do.
And I just wanted to give a commercial and a shout out to the group at the fair. I felt horrible a day or last week. It was just computer tech fatigue, but I went and got tested, and I was going to go to the library to try to get a free test. And I happened to see the gold lot was wide open. And I went in, and the whole thing took me under a half hour. I wasn't pre-registered. I got both the rapid test and the PCR, and people were so kind. So it took me 2 hours to try to Google where to go to get a test and 5 minutes to drive to the fair and do it. So a commercial for that.
I'll tell you, the first testing run we did at the fairgrounds, boy, that must have been April of 2020. It was sideways rain. It was one of the most miserable days of my life. And the first vaccine clinic we did at the fairgrounds was just as bad. So I'm glad we've got it dialed in.
I picked the one sunny day of the month. So, and then one more question. Could you clarify again, you said it and I didn't write notes fast enough, the difference between quarantine and isolation?
Yeah. So quarantine is exposure, and we're waiting to see if disease shows up. And isolation is you're either a suspected or confirmed case. Okay. What other questions? Sarah.
You may have mentioned this, and I apologize if I missed it. What is with Omicron variant? When's the ideal testing day if you may or may not have been exposed? When's that sweet spot of testing?
Yeah, great question. So PCR test is going to pop positive sooner than a rapid test. So rapid test, optimally, you want to wait 5 days. PCR test, the current guidance is between 3 and 7 days. Sarah, does that answer your question before I move on?
It does. Thank you so much.
All right, who's next?
I have a question.
So I have a question. My dad had an extended stay in a care facility recently that was on we'll call it COVID lockdown. I was the only one allowed to come in. I had to dress up in full PPE, which I was totally good with. My concern is many of the staff members in this facility were not following the guidelines. Yeah. Masks were down here, and and their numbers were climbing all the time. So what can somebody like me do to turn them in or whatever? Two things.
So first thing you can do is you can call the care facility and ask for the nursing supervisor. That may or may not be helpful, and I can understand why you might want to be worried about that if you have a loved one in that facility.
They're gone now, so I've waited until they were gone.
Okay, good. So the other thing you could do is call this number on the board here and ask for the outbreak investigation team. And you can make an anonymous tip and say, hey, I was at this facility. I saw people were not being careful with masking. That every facility in the county is assigned an outbreak investigator right now. So, they'll give it to the person that's in charge of that facility. That person can then bust their chops a little bit. I think it's the way we say it.
That'd be good, because I did take it to the nursing supervisor the first day he was there, and because I was kind of shocked. I mean, I'd walked in and I mean, several of them, their masks are down here, and I'm thinking, that doesn't do you any good, guys. And
Yeah, that makes me angry to see it at the
Nope.
grocery store, let alone a nursing home.
exactly, yeah.
Yeah,
I was
yeah.
furious.
Yeah, I do want to, that's a hard industry, and they've taken a big hit this year. They've shed staff, and the mandates made that problem even worse. So I'm not surprised if they've got some folks working there who are maybe not the best trained, but that's a bad
No,
excuse.
I believe that. I know it's difficult. Yeah, so and then I had one other question. My daughter's an RN. I'm not going to say where,
Okay.
but she has been told by her organization that even if she tests positive and if she's not symptomatic, she should come to work.
Yeah, so that's crisis staffing standard. And that's not supposed to be a you should thing. That's a we don't have any other option thing.
Yeah, I know they have FEMA nurses coming in now. So, okay, so I just
I
thought,
do know that a lot of the hospitals locally, if it's in this area, I guess that's the definition of locally, have been on crisis staffing for at least 10 days now.
Okay.
And which is terrible, right? That's not something I thought I'd see in my career. Hopefully that hospital or that organization or that clinic has a set of guidelines to keep the people who are known positive cohorted and working with other people who are known positive. That's what they're supposed to do.
I hope so too.
Oh, I've got a question.
Yep.
So, in a brave moment of candidacy, there we go.
Candor.
Candor, there we go.
Andrew.
That word. I have been exposed.
Me too.
Congratulations.
Yeah. So, the exposure was via a grandchild, as it turns out, a day visit. So,
A vaccinated grandchild, no less.
yeah, who and his underage sis is now tested positive, and so we're waiting with bated breath to do what we know we're going to end up doing. A, if we have symptoms, or B, 5 days down or 6 days down the road.
Did you want to workshop that a little bit?
Do I want to workshop that?
Would you want to like talk it through and what how the guidelines would fit?
Yeah.
Yeah, okay. What day was the kid there?
Monday.
Monday.
Monday. Okay, so today's Wednesday. My dates get ahead of me, but today's Wednesday. So today's day 2 of quarantine.
Yeah.
If you're uncomfortable answering, don't, but are you fully vaccinated and boosted?
Yes.
Okay, so then you wouldn't require a formal quarantine. But, and how long was the child there?
About 6 hours.
6 hours.
Yeah, okay, so more than 15 minutes.
Oh, yeah.
And had, what day did that child develop symptoms?
Tuesday morning.
Okay, so that would be within, so usually we do a 48-hour window prior to symptoms starting. That's when you'd be contagious. So that would fit into you've been exposed, but you've been vaccinated and boosted. So based on that guidance I popped up there, you would be able to go out in the community, but you should wear a mask if you did. And if you develop symptoms, then you're on the bench. If you develop symptoms, then the next thing to do would be to call your provider to see if you're in one of those high-risk groups that would be eligible for starting probably the oral therapy outpatient.
So I was supposed to take my 91-year-old father to a doctor's appointment today.
Mm-hmm.
I chose not to go do that.
I think that's smart.
Just because he's the one I was telling you was in the kid. We don't want him back in the hospital.
Right.
So
And he's the guy we're all trying to protect.
Yeah, it is. And so our thought is that we should stay away from them. Is it the 5 days, or should we push it longer just to be sure?
I think if you haven't developed symptoms in 5 days, I think you're probably pretty good not in the woods. If you're with the caveat that maybe you wear a good quality mask to hedge your bets. If you've got one of those rapid tests available, that'd be a really good time to deploy it too.
Okay.
So another question in the scenario. Pardon?
We shouldn't hog everything.
Oh, yeah. Just one more quick question. So, we got word of the grandson's condition on last night, Tuesday night.
Okay.
So what is the risk of us having exposed anybody else during Tuesday, on the day Tuesday, to the virus?
So if you don't develop symptoms before end of day Thursday, minimal.
Okay.
But if you develop symptoms tomorrow, it would be worth a call to anybody you're around.
Okay.
Okay.
Hey, Matt, I'm going to chime in real quick. Do you mind stopping and sharing your screen and we can just have a conversation?
Oh, yeah. Thank you. Good idea.
And David and Caroline, I don't know if you were in Puyallup, but I went to the library to pick up a rapid test and it took seconds. You don't call ahead, you just drive up by where the voting box is and someone comes to your window and asks what you want, and then they toss it in your window and you go on your way.
Yeah, I want to give a shout out to libraries in this county. They've helped us a ton and been just great partners for us. Yeah, I see a hand up over here.
I have a hand up.
Yeah,
Um,
you must be Rick.
I am. Yeah, I had to add that in there so you didn't call me Karen.
That's what was confusing.
And David, I'll expect you to be ushering Sunday now that you know what your quarantine period
Right,
is.
I put all his business on the streets.
Just kidding, buddy. We have what I consider to be pretty good quality cloth masks. I think they're 3-layer, commercially made. But we just recently bought some KN95 liners for them. Does that make a significant difference?
Sure does. Yeah.
Okay.
I was hoping personally the CDC would recommend against cloth masks, at least in some situations. I see you got your hockey shirt on. I think the time to deploy that would be if you're at if the hockey arena, or you're at a grocery store where people are going to be pretty tightly packed. But I think the cloth mask would be fine if you're, I don't know what a good example would be. You're going to the craft store and there's just going to be 1 or 2 other people in there.
Well, I'll give you an example of Sunday morning. I was a scripture reader and I wore my mask with the KN95 filter all the time, except when I read the scripture. I wore a different mask that didn't have the filter in it because I could be understood better.
Yeah, and you're up in the pulpit and probably 20 feet away
So-
from anybody else.
Yeah, he was distanced.
Yeah, I think that's reasonable.
Thank you.
You didn't trip over your words, did you?
Oh, I did on one sentence, one couple of words. You practice and you practice and you practice and you still mess it up. So
Tell me about it. I do this for a living. All right, other questions?
I have one.
Yeah.
I worked the fair and they tested us during the fair in September, the employees. And I got tested twice, once midway through and once the last day of the fair. But I was wondering, do you know what kind of test they used? Was it the PCR?
I do. I was there. We did PCR tests.
Okay. I was just wondering. Okay.
At least the days I was there. They didn't give you a result right away, right?
You had to sit there for, 20 minutes.
Oh, then you did do a rapid test. If you got a result in 20 minutes, you did a rapid test.
Right. And then they gave us our paperwork. Yeah. Okay. So it was rapid. Okay.
Kim,
Ron?
very good talk.
What's that?
I have a question.
Yeah. Hi.
I'm wondering how contact tracing is working through the health department. Is that still happening with everybody doing rapid tests at home and maybe going on to PCRs? Is that information getting to where it needs to be?
Between having rolling outbreaks in nearly every nursing home in the county, 4 times as many cases we've ever had, cuts in funding this year and loss of staff, contact tracing has gotten really minimalist.
Okay.
And, last year, when we first started out, we were having 15-minute conversations with most everybody. Now it's pretty much leave a message on the machine, call us with questions. And, another thing I could put a plug in, we do care packages for people who We don't have resources, so the county will come and drop off. I think it's like a food package and a few other cold remedy things. So, but yeah, the ability to do contact tracing when 15% of the county is positive, it's just not valuable in the same way as it was when we were only having 20 or 30 cases in a day.
Okay.
And most of the contact tracing we're doing is through the schools, the jails, the shelters, the congregate sort of facilities.
Okay. So your recommendation is if you do pop up with positive, is that you do your own counting and you notify those people that you've been around?
Even better, even better. Call your provider, and if you rapid test positive, that provider is supposed to report it to the county. Then they'll get a call and it'll set that
Okay.
process.
Okay. Great.
But that doesn't ensure that they're going to do a very thorough job with it. So if you, like
Right.
when David was talking, if you were around somebody that you know and it was 48 hours before you started with symptoms, it'd be really kind of you to give them a call.
Right. Right. Okay. Thanks.
Yeah, you're welcome. Gretchen, huh?
Sorry, I feel like I'm monopolizing. So a couple of questions. One with the pop-ups on the cell phone. Last week I was self-isolating anyway because I'd been exposed at school and I was worried, but I must have gotten 6 pop-ups on my phone that I was exposed. So at some point I'm like, yeah, been there, done that, know that.
Got it. Was that through Washington Notify or was it through our county?
The Washington Notify, I think.
Yeah. So that system, somebody asked me about that system this morning. That system, I don't think it was as helpful as they intended it to be.
So Pierce County has one too?
So Pierce County would send you text messages if you got if the contact tracers.
Okay. Yeah, I just kind of, what could I do? By the 6th notification, I was like, okay. My other question is about the masks at school, because we had staff members down. We have changed. We're on remote learning now, but when we go back, hopefully next week, it's now required to wear the KN95. Is that right? Masks.
Yeah. Okay. That's a policy of the schools.
Yes. So a couple questions. One, I was horrified when I looked up the price. Absolutely horrified. And for the families that have 3 kids, I mean, it was expensive to me, and I don't have kids, and my husband and I can afford it. So I was like, I don't know what our families are going to do. So I don't know I hear they're going to start giving out free masks.
They are.
How
that
does
was just announced today.
And my other question about that is, I also know that 60 to 70% of the masks are counterfeit. So how do you win? How do I even, I'm going to pay $70 for 20 masks that are probably counterfeit. So suggestions around that kind of mask.
Couple of suggestions. There's a certification. I think it's NIOSH. That's the certification that
But it's hard to see if you're ordering on Amazon.
Good point. Good point.
I really looked, and finally I'm like, I'm just going to order, and if they're counterfeit, I'm doing the best I can.
Amazon is a wasteland, and they need to crack down on that. So another thing to think about, your school's in King County because it's in Tukwila, but you might check in with King County Public Health if they've got some programs for you. I know that we've donated a lot of masks through the school districts, and I don't know, it's been a while since I've talked to any of the private schools in the county. My guess is that we've done some of that too. I just don't know about it because I wasn't in those meetings.
I serve public school students, so if they're doing it for the public schools, we should be able to access it.
And I can't speak for King County, but we've done a lot of that in Pierce.
So King County Health Department?
Yeah.
Okay.
Yeah, give them a call and see if they've got some resources available.
Thank you.
If you want to find less expensive KN95 masks, look in the paint aisle at the Home Depot. They sell in bulk. And the thing you mentioned about the federal government, they just announced today that they're going to donate, I think it was 500 masks. I don't remember the specifics of the program, but that website's not up yet. I would expect it will be within a couple of weeks here. Also understand that those masks can be reused if they're taken care of well. They need to be sealed they need to be put in a paper bag at night, but you can use them the next day. And the CDC has some really granular steps on how to keep those clean. I don't know how old the kids you're working with are, but if they're
3 through 18.
Okay, I bet the 12s and ups can handle it. I'm not sure the 3-year-olds do well.
Yeah.
All right, other questions? Oh, did we do it? Somebody with a hand up, but I can't see him.
Robin has
Robin.
something to say.
I'm trying to get unmuted. So you mentioned the contact tracing and that you would get a text and that would be and that was through the county. That would be if someone's reported themselves to the county and said, I've been around Robin, they would contact me. That's not an app or anything like that. That's just
No, that's a human contact.
okay. All right, thank you.
All right. Any others?
I'll ask one more for the heck of it and I can email you, but Matt, do you know anyone in King County that would do a similar presentation like this? Like for our school for a parent night?
I bet Rachel would be a better. Rachel, do you have any more?
Sorry, trouble getting unmuted. So I'm not as familiar with the King County folks, but that's certainly an ask that we could bring back. And there might be somebody on our team that would be connected. Would you mind just sending me your email address or some sort of contact information so I could reach out to you?
I will do that. Robin, do we have Rachel's email or just Matt's?
Yeah, I'll send them both to you.
Okay, thanks.
And if you guys can't find somebody, I'm just right up the hill from there. It's not part of my duties as part of Pierce County, but if you're looking for somebody to come and give a talk like this, I could probably squeeze it in my schedule. All right, other questions?
Is the I'm assuming PowerPoint presentation that you included tonight, is that a PowerPoint presentation or is that available on the county website or?
It changes so much that we
Yeah, that's true.
change it almost daily. So I think I can send it to Rob. If I send it to Robin, can you help to?
With the caveat that it changes daily.
Yeah.
That it changes daily. And the other caveat that I gave a talk in Graham this morning. So the title of it is going to be Graham instead
No,
of
it's okay.
Christians.
Guess I have a
No
quick
offense
question.
intended. Yeah, what's that?
Do you have any advice on when you're dealing with people who are anti-vaxxers of what you can say that's real and like, hey, look this up.
So that's a frustrating one. I dealt with that this morning on one of my politics calls, and it can be really contentious. And especially 4 months ago, or how many months ago that was now, when the mandates were the big thing on the table, I was watching this tear families apart. And I think that's sad. It's tragic. A couple things to say about it. That when somebody's talking to you about that they don't want to get vaccinated, oftentimes they'll center the conversation around safety. And that's the playing field they'll stay on. But that's usually not what the issue is. Usually after 4 or 5 rounds of that, it gets back to, I don't trust these people. I don't want the government to tell me what to do. I don't want my boss to tell me what to do. And that's the place where the conversation becomes helpful, right? That's the place, that's the territory where the real concerns are. So getting through some of the weeds of I heard this thing about this vaccine, getting through that to what the real concern is, I think helps to have productive conversations. And one of the things I've said really ever since we've done mandates at the health department, look, I'm not a politician. I don't want to get in the weeds of red state, blue state, or the governor this or the county commission that. I just want to do what's best for your health. And I can point to these numbers that say if you get COVID, you're 10 times more likely to die if you've not had this vaccine. And if you're 30 and you think, well, I'm not going to die anyway, fine. Because 1 out of 4 people who gets COVID ends up with symptoms that go on for months afterward. I've got a nurse in my practice who can't work anymore because she got COVID 3 months ago and she can't walk up a flight of stairs and she can't remember the things she needs to remember to work in the ICU. I've talked to 20-year-olds who have erectile dysfunction. This is not something I ever saw in my practice before COVID. There are things that are scary that happen to people when they get this disease. And vaccination is still the single best tool we've got to prevent it. If you're not willing to do that to help your community, then I hope you'll double and triple down on all the other things that you can do. Yeah. But I always try to center the conversation on the positive. Like, what are you going to do to help the people around you? Because these conversations get negative really, really quickly. Yeah, thanks for asking that. That's something that's sort of fallen off my radar screen. All right, other questions? Rachel, I know you're thinking of something I forgot.
I'm actually not, Matt. I think you covered it.
Do I get to keep my job?
I won't tell anybody.
I have one more.
All right, what's that?
How much of this is going to change when the next variant comes out?
Well, that's a tough question. And I don't think we should assume that there's going to be another. It's very possible that the World Health Organization did a talk yesterday and talked about how does this pandemic end? And the way this pandemic ends is we get the vaccination rates in Africa and some parts of South America and some parts of Southeast Asia. We get those up to what they are in most of the developed world. And then this stops being a crisis because that's where the variants are going to spin out of. If we have another variant, we'll deal with it. My hope is that further variants will be responsive to the same tools we have now. The Omicron variant has been so much different than the other ones. We lost a lot of therapies that were in development and our vaccines got a lot less efficacious. But if the next variant is part of the Omicron family, Pfizer is developing a vaccine that's specific to that variant, so we'll have that tool to play with. If it's part of the Delta lineage, which I think is a lot more likely, then we've got all the benefits that we had prior to. So every time we go through another round of this, we'll be better at it. And we'll have more people vaccinated. We'll have more people with immunity because they caught it the last time around. And I think a year from now, what we'll be talking about is pocket outbreaks. Like Gretchen's school had a couple of cases. We'll close them, we'll surround it, we'll deal with it that way. We won't be talking about community-wide outbreaks like we've had this winter. I hope that's right. Yeah, Sarah.
So you kind of mentioned, and I think this might be the right phrase, vaccine, is it vaccine equity?
Yeah.
Or getting, how, is there a way you recommend that we can be advocates for getting vaccines more accessible worldwide? I know that's a random question, but if there's like an organization or.
Yeah. I thought that was going locally and changed my train to it.
Sorry.
I mean, there's a lot of buzz around that. If you're active in the social media, that's a place where a lot of that conversation happens. If you want to write to some of the, one of the ways that happens is the federal government donates vaccine to different countries. So you could write your federal legislators and try to get it happen that way. I will tell you that in the last few months, we've made a lot more vaccine available, especially to African nations and to some parts of India and Pakistan or another place where the access has been really, really poor. So we've tried to do a lot, but there's a lot more to do. Another thing you could do is put your money where your mouth is and make a donation to the World Health Organization or another group that does that. The Gates Foundation is another group that does a lot of donation of vaccine. You know, one of the problems we've had is that the vaccines that we use in the United States, the mRNA vaccines, are not very stable. So if there's a place with problems with supply chain, then they're not as workable. So we've got a sort of a different group of vaccines that we don't use here. I hear people talk about, well, if you waste vaccines here, you're taking a vaccine away from somebody who really needs it there, but that's really not true. And equity is always a really important conversation. We spend a lot of time at the health department trying to get to communities in Pierce County who are underserved. So I always love it when I hear that word when I'm out talking to the community. What else? Okay, my voice is barely hanging in there.
It's so helpful, so helpful.
I want to plug it, put in a plug for Croy Waters. That helps me
All
I want to make
right.
sure everybody saw I wasn't drinking beer over here.
well- Darn.
We'd be fine if you were.
Yeah, we'd be okay with that after a long day. If there are no more questions, then I just want to thank Matt and Rachel for coming. Any more questions? Last call. Well, thank you, everybody. Thank you, Matt and Rachel. Really appreciate it. Squeezing in on this, on our short time frame. And don't forget to support Matt and Rachel's free will offering of the NAACP. And that's at fccpuyallup.com/donate. And I just appreciate you guys coming very much. It's been very, very helpful.
All right, well, thanks everybody for listening,
Thank you.
and good luck with your vaccine clinic.
Yeah, thank you so much. See everybody tomorrow.